I am joined, as I am each month, by our own Dr. Joe Sirven of the Saturday WJCT program and podcast, What's Health Got to Do with It? He helps break down the latest medical headlines and takes your calls and questions. Welcome, Dr. Joe.
Hey, Ann, it's so good to be here. Happy November. I can't believe it.
Oh, I can't believe it's November already. This year has flown by. I'd like to hear the medical research on that. If you'd like to join our conversation, you can give us a call and ask Dr. Joe on any healthcare topic. You can reach us at 904-549-2937. You can email firstcoastconnect@wjct.org. Of course, you can reach out on social media at FCC On Air. Dr. Joe, before we get into it, I just want to start with some big news. You and the program, What's Health Got to Do with It? You're going national.
We are excited as we, at least starting out in Florida, our home is always going to be Jacksonville, but we're excited as we move forward to several new markets in Florida. This is on the radio side, and even a new one in Texas as well. It's a way that just tells us that people want health information, and it'll all be emanating from here, our home, but going out elsewhere. On the FM, but mind you, podcasts you can get from anywhere in the world.
Sure. I mean, people do really want unfiltered medical information,
do.
Voices that they know they can trust. And you're obviously our choice for that. But I'm glad to see that it's expanding. So we should say there's 5 new public radio stations
Right.
in Florida, from Gainesville and Orlando to Fort Myers on the West Coast, Vero Beach on the East Coast, but also Texas, Arkansas, and Oklahoma. So this really is a big expansion of the footprint.
We are excited because I think that the same questions that someone in Oklahoma or Texas have is going to be very similar to someone sitting in Orlando or the Treasure Coast. It's always, who do you see and how are we going to pay for it? And then how do I handle it? And that's what we hope to do. How do we navigate this very crazy, flawed system?
Yeah. Well, congratulations.
Thank you.
For those who want to listen to What's Health Got to Do with It here locally, it does air every Saturday night on WJCT at 4, every Saturday at 4, and every Sunday night at 9.
Right. Yes.
So, and of course, you can get the podcast. So hopefully you'll remember us when.
Never will forget. It's our home.
Right. All right. Well, let's move on to a topic that is never far from our minds here in morning radio. It has to do with sleep.
Yes.
Especially this week, even though we get an extra hour, a lot of us are moving in the opposite direction, according to research, and here in Florida, for sure.
Yeah, I mean, the reality is the daylight savings always brings us and this I might add, the end of daylight savings, we are now in regular normal time, always brings us this conversation about sleep. The reality is most of the times when talking about that time switch, most of our problems tend to occur in March when we make the jump forward. But this is our moment where we are a little off kilter, off sync, because that hour, although lovely, when we get that extra hour, we're still, our stomach is still on our old time. Our heads may be at another time. You may feel foggier, sleepier. I know I did on Sunday. I was looked to my wife. I'm like, does it feel like 4 o'clock to you?
Yeah. Well, it's that thing. You may get an extra hour of sleep, but then the night comes and it just starts to feel like, is it only 6:30? It feels like it's about 8 o'clock at night,
And that's what's so hard. It just tells us that we have this internal body clock. And one of the things that sleep research is telling us, especially in these time changes, is really getting yourself out into the outdoors and exposure to light. That really helps. Nothing better than having light exposure to set you up for your clock to, in essence, to be reset to whatever time it is. And so that's my little suggestion to anyone, because especially on these gorgeous days right now, go outside, get that light, because that really will help you kind of readjust.
And exercise too. I mean, in terms of resetting your clock, kind of getting into the new rhythm, that is an important way too.
Absolutely. Exercise is never a wrong answer.
Yeah.
So this is, and right now you can walk anywhere with this beautiful weather. This is a perfect time to take advantage of it.
We've got a question from Scott. He emailed, I'm over 60 years old and I wake up just about every night between 3 and 4 in the morning. Is there anything I can do to get a better night's sleep?
Yeah. So the question, Scott, what I would say is, number one, we'd have to understand what's going on before you go to sleep. Is there something waking him up? Is it that he may not be breathing right? Is there some sleep apnea? Is it the food? What are his habits right before he goes to bed? Does he take long naps during the day that offset you? Do you switch shifts? There's so many possibilities there. It's that for Scott, I would tell him that may be something to do. A diary would be my best thing. Write down what you're doing, what you're eating, exercising, and then from there, use that to talk to someone in the world of sleep or primary care doctor to see if there's maybe a simple solution for him.
There has been some research I've seen as well that says, alcohol or caffeine within
Mm,
4 hours of
yeah.
bedtime can be really disruptive.
I will tell you, I do not drink a cup of coffee or tea after 3 p.m. It pretty much because there are effects, lingering effects of caffeine that can really impact you. In the morning, it's okay for a little boost, but for some of us that are more sensitive, it could really make a difference in terms of getting to sleep.
So I want to ask you relative to that because there's also been some information about melatonin and
Yeah.
concerns about using it consistently, regularly, particularly at high doses. A lot of people use it right now routinely,
Yeah.
and there's some issues that it could impact cognition or maybe even lead to short-term memory loss, particularly in young people.
So melatonin is one of those complicated issues. In small doses, as you need it, it is probably going to be okay. But taking it consistently or overusing it, like in any substance that you take, it's almost like if you take a tape of this
Right.
next month and the month prior, it's going to be the same answer. Anything that's in excess or not or kind of being used for a purpose that you think is helping, but it's not, it may not be the best thing for you. So my sense is if you need to take melatonin every night, maybe there's a problem that needs to get fixed
Yeah.
and needs to get looked at in that regard. So I would not take it willy-nilly, but my only thing I would say is that it is okay to take it for the rare instances that you just feel that you need it to help sleep or you're shifting like you're traveling to the West Coast, East Coast,
Jet lag.
that type of stuff, that it has a very unique and very helpful use in that regard.
Okay. New research, Joe, on COVID and pregnancy.
Yeah,
And,
yeah.
this is timely because we're learning more about the impacts of children in utero, unborn babies, when a mother has COVID. What is the new research showing?
So in this study, it was of women who were pregnant at the very early point of the COVID pandemic. So we are in the first type of mutation for COVID, and they were followed to see how they did with neurodevelopmental anomalies, meaning birth defects and things of that sort. And they found that women who had COVID during pregnancy in that first wave, they had a mildly increased risk of having some type of maldevelopment in the baby. What we don't know about this study, and this is what's going to be very big and important, is the vaccine had not been created. So we do not know what vaccinating would have done. We assume it should have been okay, but that was not proven here. But it did tell us that there is a real risk of pregnant women having a bad outcome with their baby if they are infected with the virus at the beginning of the pandemic. We don't know the other answers. What does it look like in terms of after the vaccines came out or other mutations of that virus came out? To me, what I took out of this is like get vaccinated. This is one of those things that runs counter to the original recommendation this year that came out from CDC, I believe, saying pregnant women would be excluded, and then quietly it was covered. This is just a reminder you really should be covered because there is real risk of a problem from COVID should you have it during pregnancy.
And you mean covered in terms of
Vaccinations.
yeah, and that's as you say, the secretary of the Department of Health and Human Services, RFK Jr., had basically said women should not get vaccinated during pregnancy for COVID. But then we sort of walked that back a little bit.
They walked it back. In fact, then quietly, insurance has been covering this and has not been spoken since. This is the type of study that tells us you know what, you really should be you should be protected. You should have take advantage of the things that we have for the best outcome, because we all want the same thing, healthy kids. That's
Yeah.
all of us want that.
Sure. And I mean, it's so worrisome to a pregnant woman to try to make decisions that could really stick with her kid for a lifetime.
Absolutely.
But what's interesting about this is it's not necessarily, I guess, the virus that they think was infecting these fetuses,
Right.
but more about perhaps inflammation. And that's interesting because it sort of ties into this other area that the president had been raising concerns about whether Tylenol has some sort of autism link. Um, Tell us a little bit, help us break some of that down.
So one of the things that this is telling, there's two ways that a virus can create a problem for a woman who's pregnant. One is it directly invades the baby, and literally some part of it and causes a problem. The second way is that the mother's immune response, like as it gets tied up and basically all these cells, antibodies are pouring out, creates and that and the mother's immunity, those antibodies will cross over to the placenta and to the baby, creates hara-kiri, if you will.
Oh,
So one of the things that we know now in medicine in general, most types of inflammation, whether it's related to some bug or to some chronic condition, that always has a potential risk for all of us. In this particular study, it said they did not know which of these mechanisms, it didn't answer that, whether it's a direct viral link or whether it's the immune system, but one of those things is causing the problem here.
and if it is inflammation, something like Tylenol would remedy that.
That is
So
why Tylenol is recommended as one of the few things that is that is allowed for pregnant women, particularly in those early part of their pregnancy when they have a fever.
the other thing that, in terms of when an immune system in a baby is kind of angried up like that because of the mother's response, there's also links to things like metabolic issues, obesity, hypertension, gestational diabetes. All of these things can be linked to an inflammatory response or an immune system response.
Yeah, we literally on our show, What's Health Got to Do with It, just literally did a whole segment on inflammaging, which is the concept that there is this low level of inflammation that can cause increased aging through metabolic problems like you're describing. Metabolic meaning diabetes, thyroid, hormones, and it can kind of cause problems that way. How we counter it is going to be the secret to what health looks like for the future, because we're just beginning to appreciate this.
We've got a message from Susie on Facebook. She says, congratulations on growing your audience.
Thank you, Susie.
She says, with the cancellation of Zorba Pastor, which of course is a longstanding medical program from NPR, he says there is a need for health and medical information on public radio. It always made me sad that people would call in with questions that should have been answered by their primary care provider, but our in-person visits are often so brief that patients may be left with unanswered questions. That's one of those things that doctors wrestle with as well, Dr. Joe. And you have, I think, the privilege of working at Mayo Clinic, which has taken a very different approach to the amount of time physicians are
Right.
allowed to spend with their patients, but that's not a luxury that every doctor has.
No, and it's another reminder, Ann, whether you're at Mayo or any other institution, that time is the ultimate commodity. You really want to be able to spend time to know you. You're coming to me to share a problem. That is really the way that we do good healthcare. We get AI tools and Google that helps us with the questions, but the fundamental reality is someone that knows you, that can take care of you. That's what medicine's all about.
We've got a call from Sally in Springfield. Good morning, Sally. Go ahead.
Good morning. I have a question about how often should we get the COVID shot now? I know before I think it was like every 6 months, and I'm asking specifically for seniors, but in general, how often do we do that now?
That's a good question.
Yeah, Sally, that's a great question. We are still at this time. It's really been at once a year when they have the new formulations. It has to be looked at to see what's circulating. It gives time for companies that make the COVID booster to kind of make sure that it's targeting whatever mutation of the virus is out there. If you are going into COVID endemic areas and you have not had it, that may be a reason to get it. But it's pretty much a yearly basis at this moment. That could change because when it comes to any discussion of COVID, I have learned to be very humble about any recommendations because they do change fairly quickly.
I should note I'm getting a message from my producers, also your producer, Stacy, noting that Tylenol doesn't help with inflammation. And that's something I
Yes,
misspoke. That
thank
is
you.
true. Okay, I want to talk about gabapentin because this is sort of a strange
Yes,
thing that you noticed in just the report on death, basically. I think it comes from FDLE and sort of
right.
the presence of drugs in someone's system when they die.
Yeah, so this is a report that's put out by the state of Florida looking at substances that are found in people who have died from overdoses and things of that sort. The good news in this data was that they found that there was a lessening of fentanyl and opioid based deaths. So that's great. That's wonderful. But as you look at the data when they put it all out there, you see medications that I didn't expect to be seeing in that list of drugs that were found to be associated with people who had died. And one of those was gabapentin. I think it was at about 3.3% that was listed in the statistics there. And what was fascinating is gabapentin is a non-scheduled drug. That means it does not have special DEA codes that you have to put out there. It was designed for seizures once upon a time. That's why I know it so well in the world of neurology. But it's now used for everything. And it took me a moment. I'm like, wow, how is a drug like gabapentin, what is that doing on this list? And as I spoke to others, people pointed out that when used for non-medicinal purposes, people who have opioid addictions, that gabapentin actually can magnify the high of opioid addiction, which may account for why we see that number out there. It also may just simply say that that drug is out there for so many other conditions. Everyone is using it. I know we joked about it. Even I know in our vet, my own
Dogs
dog is
certainly.
on gabapentin. I mean, this is
Why
so
is it being
common.
so widely prescribed now? I mean, as you say, it was a seizure medication, but it's being used for off-label uses, like on all kinds of things.
It is, and in fact, that has always come up as an issue. One of the reasons is that because it has almost no drug interaction, so it's so easy to give. You do not need to track it with blood tests. It is processed through the kidneys, so it's one of those drugs that you can almost give in any formulation, and it does have minimal effect. But it has had such positive benefits for people who have pain, for other type of conditions like that. That's and it's non-addictive to our understanding. That's why a lot of people have gravitated to using it. And now that it's generic, everyone has found an interesting new use for that medication.
Worth noting that alcohol is still the most commonly found
Correct.
drug in someone's
Correct.
system. So, yeah. All right. Peanut allergies.
Yes.
This is bananas. And we've been learning about it for a while, this decline, but this is really a stark reversal of what we had been seeing, a huge drop in the epidemic of food allergies, particularly with peanuts.
I love it when we can talk about a good health news story. One of the things that, as you just alluded to, people have been following is that it seemed that everyone had a peanut allergy and it was just kind of rising. There was a study called the LEAP trial that basically looked at for certain infants that are more prone to be likely to have peanut allergies, those who have eczema or egg allergies that are identified. They were introduced with peanut based food at very early ages in small gradated increments. So from between 4 months to 11 months of age. And in that study, they found almost an 86% relative risk reduction of developing peanut allergy. So the guidelines changed. So the most recent thing that's occurred is that there was a study looking at electronic health records, looking at what is the percentage of people that are developing peanut allergies just based on electronic health records. So there was not a direct intervention to a patient. And lo and behold, since those in the new guidelines saying kind of expose your infant to peanut, the rate of peanut allergies has declined significantly. So that's huge, given that I remember that was a huge issue, especially if you're flying and peanut products,
Which
or
they
if you're
stopped
school and things of that
providing
sort.
in most cases across the board, right? It was a
Exactly. I mean, this has not been a minor issue. So to those who suffer with this, and we've done a few shows on this topic, this is a major benefit. Looking at that in terms of positives, in terms of like a simple solution, if you will, to kind of doing this.
so that's a good news story, but it kind of comes after a lot of advice that maybe fed this problem. And I want to ask you about that because a guest that you've had on your program, that we've had on this
Yeah.
program too, Dr. Marty McCary,
Yes.
who is
Yes.
now the commissioner of the FDA, um, he wrote a book about
Yeah.
doctors who get it wrong. And, that's part of the reason that he's been
Right.
embraced by this administration, because he was a cynic
Yep.
and he wasn't necessarily beloved in the world of medicine, because he was very critical of certain things. But the peanut allergy was one that he identified in his book, you know, well, long ago, as a problem that he thought was created by an overreaction to allergies in kids.
Yeah, what I will say is that when it comes to, and I know that book very well, many of the items that he pointed out, he's absolutely right. There are many things that medicine gets right, and when it gets it right, it really changes lives. But boy, when we get it wrong, and I'll be in that collective we there, it really has impact. The key is that we have to be a little bit more transparent, not speak so like, pedagogically to our patients, like, we have to kind of share people what the real risk is. And I think medicine is now getting the backlash of that, given all the stuff that's going on right now.
And so the basically the problem there was that doctors were saying, because there is this
Avoidance.
avoid it. And what is the science of approaching allergies through our digestive system as opposed to through our kind of our skin system? Tell us about like the emerging science around allergies.
It's telling us that at the end of the day, that there are some elements of exposure that you need in order to develop a healthy type of immunity, not the type of immunity where you have an allergy, which is basically immunity that's run amok, that's basically reacting to something so feverishly that the reaction to the foreign object is worse than the actual exposure to whatever it is that's triggering it. What this is telling us, that sometimes we need to have some type of exposure, if you will. And that in the early days in the GI tract, that's a perfect place because food comes from external sources, right? So our immune system has to kind of get involved in that regard. But I think this brings us up to kind of an exciting moment, if you will, in terms of just seeing, hey, there are some very simple approaches that does not involve very complicated new medications or prices. I might add, from a healthcare system standpoint, that peanut allergy solution is less than a buck, or whatever the price of peanut butter is in the
Yeah,
grocery store. That
it's about
Okay,
$6.
thank
But
you for
okay.
the correction there. But that's the cool part of it. What a simple thing to solve something that could cost hundreds of thousands of dollars if
The
you have to do
treat.
over the treat and get managed over your lifetime.
If you're just joining us, we're talking to Dr. Joe Sirven of the podcast and WJCT show, What's Health Got to Do with It? He is here for his monthly house call, and he is available to answer your questions on any healthcare topic. You can give us a call on air at 904-549-2937. You can also email firstcoastconnect at wjct.org, or you can reach out on social media. All right. I want to ask you about heart disease and exercise when it comes to men versus women, because
Yeah.
this study was really surprising in terms of, I mean, we're always hearing, exercise, as you say, exercise is never a bad thing. And in this case, they were looking at people who had existing heart disease and how their exercise regimen was impacting their health.
Yeah, so it was a United Kingdom study. They basically had individuals who wore an accelerometer. So, and this is basically a device that would basically kind of gauge how much physical activity they were doing. That's important because a lot of times those studies are done on survey and scouts on,
Self-reporting.
right? And self-reporting. Everyone thinks they do a lot more than they do, but this gave you actual data. Then they looked over a period of 8 years to kind of see what's the cardiovascular risk. I'll bring out why I brought up
or benefit.
or benefit.
Yeah.
And this is important for the United Kingdom Health Service. They're followed by the same people from birth to death. So they don't have a fragmented system. They know those records from where you are, assuming you didn't leave the country. What they found was, I view this as kind of what's the return on investment for your exercise. And women had a better return on investment than men did for the same level of exercise. And that is huge because it starts kind of giving us more personalized data about individuals. And number two is that there are biological differences between men and women in terms of the return on investment from exercise. Having said that, let me kind of just to make sure that guys don't give up and women, same story there. Exercise helped everybody, but the return on that, like the difference between the risk of developing cardiovascular disease was better in women than men for the same amount of exercise.
And the numbers were really crazy. So basically they were saying for your risk of heart disease to drop by 30%, which is, no small thing. But for that effect, that return on investment, women needed 250 minutes of exercise and men needed 530 to get the same benefit. Basically, men needed 9 hours a week of exercise to get that same benefit.
Yeah, and that's the part that, a part of me is I'm hearing that, I'm like, I want to go on the couch now and like I'm really
not on the Stairmaster.
But not on the Stairmaster. But it does, but again, that's why I think the way I look at it is not to take it because it's, again, looking at it for 1 week of activity over 8 years. And so the way I view it is that it helped everybody, but yes, women did better with it. It's just a reminder that for women, keep doing what you're doing. This is, if we're all moving, it all helps. But yes,
bad news for the dudes.
Bad news for the dudes in this regard.
We've got a question from Jane on Facebook. She says, can you discuss why lactose intolerance increases as we age? And what's the best test to determine if it's a milk allergy versus lactose intolerance? I mean, I don't even know the difference, first of all.
Yeah, so what I will say about that as you do age, sometimes it has to do with the enzyme that helps to break down one of the proteins in milk. And so your GI tract may not be producing enough of it in order to make that breakdown. Why that occurs, what happens with aging, I may not have the best answer for that, but I will just say that it has to do with the presence of that enzyme, and there are easy products to help you with it. But it is something that you do find, like, for some individuals, being able to kind of like the idea of a deep dish pizza loaded with cheese when you're 60 may feel quite differently than when you're 20, but it has to do with how much enzyme you have there to be able to break that down. But it's a great question.
It does seem like there's a lot of things when it comes to your immune response that as you age get less effective.
Yeah, there are something, and the question is it the aging, or is it? I'm going to go back to the topic, which is, or is it inflammation? Is there something about what's going on, how we're taking care of ourselves, the exercise, the food that we intake that's having the impact? Is that what causing the problem? That it's the immune system going slightly awry? I mean, what we keep finding is that the immune system may be the key to everything, from cancer on, from dementia and everywhere, is what I think is the real story. If you look at this from a wider lens, that we keep finding that crosses over all of this stuff.
It'll be so interesting to see, how research takes us in our understanding of that, because it does seem to impinge on so many things.
Well, that's why I find it interesting, like biologics, new immune therapies. That seems to be the hot trick, whether you're talking cancer, you're talking Parkinson's, where you're talking dementia, ALS. What do they all have in common? It's all about some type of harnessing your immune system to attack bad things from occurring. But a lot of those things is how do we get into that position to begin with? That's the healthy living. That's lifestyle. That's the exercise. That's the food that we eat. That's the stuff we need to focus on.
All right. I do want to ask you about flu season a little bit.
Yeah.
Typically it kind of gets rolling in October, so maybe we're a month in. But I saw that there was some early early flu season arriving in the UK, and I don't know in like our global world that was causing some alarm there. Recommendations for people to kind of really buckle down and get their vaccines. But does that translate to the United States? Does that matter to us?
It does to some degree because sometimes what happens over in Europe, we're going to be they're a little kind of the early indicator versus us that may be the lagging indicator. It's something for us to watch. I think what we are hearing more about these days is the rise of RSV, respiratory syncytial virus, which is definitely up in cases in Florida and around the United States. Flu is just beginning to emerge. People are getting, I just got my flu shot. Remind everyone, get your flu shot now. But flu, this is the beginning of that season. People are now inside. The holidays are upon us or near so, and people go inside homes and exposure so easy. So what I would say is that I would take that as a signal that it is time for us to get serious about it, protect yourself. There's stuff that we can do. Flu vaccine is available.
What is the deal with the RSV vaccine? Is that something people should be? I mean, you say that it's surging a little bit.
It is, and for particularly older adults or very young kids, that vaccine is available. It is recommended. That is not a pleasant bug to have for those that have had it. It is increasing, and that number, we're seeing it across many states, not just Florida. So, and something just to be mindful about: hand washing, people around you, mask wearing should you desire. Those things are really helpful in helping prevent the problem.
Just finally, this is sort of a little bit of good news, I guess, as well. There's some research into the benefits of text therapy, which is kind of fun because, I mean, that's, just one more approach for people to have access to mental health resources. It didn't even exist, I think, 5-10 years ago, but now there's this option. And they were comparing it to
Video. Yeah.
video therapy. Yeah.
I love this. This is just another way of using technology in a good way for people who had, let's just say, a very either low level case of depression or those that are just beginning to kind of feel that, if you will. And they found that it wasn't that it was superior, but there was an equivalence to video, that even texting a health professional over what your symptoms are can be very helpful. That's very nice, so that instead of necessarily having to talk to someone directly or spending all this time for something as simple as a text in an early low level case, meaning it's not severe, it may be an option out of many options, even before medications or something in that regard. And I took that as a very positive sense. Does not replace other treatment options, particularly if it's severe or very impacting you, but it is another benefit that, as simple as a text, can be useful in a whole lineup of things that we can offer people.
Well, Dr. Joe Sirven, we love talking to you. Thank you so much for coming on and giving us the monthly house call. And congrats again on your program expansion.
Thanks so much, Anne. Can't wait to talk to you in December.